बिस्मिल्लाहिर्रहमानिर्रहीम। शुरू अल्लाह के बाबरकत नाम से जो बड़ा मेहरबान निहायत रहम करने वाला है। आज हम एक्यूट मैस्टोइडाइटिस डिस्कस करेंगे। As the name indicates, it is the acute inflammation of the mastoid intramedullary cell by pus-forming organisms, so acute bacterial infection, and most of the time it occurs as a complication of acute suppurative otitis media. You might remember from the previous lectures in which we discussed acute suppurative otitis media, the various stages of acute suppurative otitis media, which were stage of pre-suppuration, stage of suppuration, stage of nipple formation and discharge, and stage of healing. During these stages, we have already discussed that most of the time, if the patient gets proper treatment, the recovery occurs. But if the treatment given to the patient is improper, or the patient does not follow the instructions of his ENT surgeon and he stops medical therapy early, then the condition may not recover totally. After the discharge comes out, at the stage of healing, there is hindrance in the process of healing. Maybe, for example, the antibiotic which was given to the patient, after 3-4 days the patient stops that drug thinking that he is okay and alright. But what happens is, the pain which was decreasing and that was almost finished, the discharge from the ear that was also almost finished, apparently, again the patient starts having pain in the ear and recurrence of discharge with development of temperature. So this situation is indicative of developing mastoiditis. Pathologically, there is inflammation of the mastoid intramedullary cell and formation of pus in the mastoid area with the necrosis of the bony walls of the ear cells, leading to coalescent mastoiditis. And the patient comes to you, he is having pyrexia, that is temperature, and malaise, and otalgia, that is pain in the ear, and otorrhea, that is discharge from the ear which is mostly purulent or maybe sometimes mucopurulent. When you examine such a case, you will feel the patient is having deafness, which is conductive in type, can be easily confirmed by tuning fork tests, the Raynaud's being negative, and Weber lateralized towards the affected ear, confirming conductive deafness in the affected ear. Patient can have headache when there are chances of impending intracranial complications, or patient can have vertigo if there is chance of developing labyrinthitis. But if that is not the situation, the patient will complain of pyrexia, malaise, otalgia and otorrhea. The patient will be pale looking and having moderate to high grade temperature. Locally, when you examine such a case, there will be discharge present in the external auditory meatus, and if you clean the discharge by suction or by dry mopping and have a look inside, you will appreciate sagging of the posterior canal wall, sagging of the posterior meatal wall because of presence of abscess in the mastoid area posterior behind the posterior wall of the external auditory meatus. The sagging of the posterior meatal wall is a good indication of mastoiditis or mastoid abscess. The tympanic membrane obviously will be having perforation. There can be granulation tissue formation or polyp formation visible in the external auditory meatus. A very typical feature in this condition will be when you palpate the mastoid area behind the ear by deep pressure, it will be typically tender. So tenderness over the mastoid process is a very good and important indication of presence of mastoiditis or mastoid abscess. Ultimately, when the well-formed mastoid abscess that can present itself in the form of a subcutaneous swelling over the mastoid area, when the pus from the bony tissues leaks into the subcutaneous tissue and a swelling is formed behind the ear over the mastoid area, that will be a typically developed mastoid abscess. Patient does have headache and sometimes drowsiness because of impending intracranial problem. Investigations which you can do to confirm the diagnosis is the X-ray mastoid that will show you breakdown of bony wall of the ear cells, and you can also send pus for culture and sensitivity. So typical haziness of the mastoid area on mastoid X-ray will be there, and pus can be easily sent for culture and sensitivity to select proper antibiotic which will be effective for this condition. So diagnosis of the mastoiditis can be easily made by its history of an acute attack of acute suppurative otitis media, the otalgia which is progressively increasing, the pyrexia which is not settling and increasing, and persistent otorrhea, and conductive dysphonia which is again progressively increasing, it's not settling. And ultimately, when mastoid abscess is formed on the surface of the mastoid process, that everything is apparent and the diagnosis can also be confirmed by X-ray mastoids, which we have just discussed. The complications which you can come across, they can be mastoid abscess, various types, labyrinthitis, petrositis associated with seventh nerve palsy, that is Gradenigo syndrome. Patient can have simple mastoid abscess over the mastoid process, or he can have Bisol's abscess or Cytali's abscess, facial nerve paralysis, extradural subdural abscesses and meningitis, and also brain abscess, lateral sinus thrombosis, etc. Treatment. Obviously, it is acute infection by suppurative organisms. So antibiotics effective against those organisms, preferably confirmed by culture and sensitivity test, they should be utilized for sufficiently long time, more than a week, so that the infection settles properly. Analgesics and antipyretics, they can be of some help to the patient. But if in spite of your medical treatment, the antibiotics which you are using by injectable route preferably, and giving the patient analgesics and antipyretics and cleaning the ear, everything does not work, and the patient's condition go on worsening, then you have to go for surgical management. And the surgery for this purpose is cortical mastoidectomy. It is carried out when there is mastoid abscess formation and failure of medical treatment. One simple way, when there is mastoid abscess developed, you can do incision and drainage of the abscess and give good medical therapy. The patient might recover. But if it does not recover, still there is persistent problem, then you have to go for cortical mastoidectomy, which is basically a drainage operation of the mastoid intramedullary cells, where by giving post-oral incision, you open the mastoid antrum, destroy the diseased mastoidal cells, and drain this cavity to the exterior with the help of a drain. That is what you call cortical mastoidectomy. Have a look on this picture showing you acute mastitis, acute inflammation over the mastoid process behind the ear. This is another picture showing you swelling behind the ear, a developed mastoid abscess. Fluctuations will be positive in this case, the same boy shown in different view. This will be a fluctuant swelling behind the ear indicating presence of pus behind. And after doing cortical mastoidectomy, stitching and dressing has been done in this case, and you can see that. Now let's discuss a few words about Bisol's abscess. Among the mastoid abscess, various varieties of the mastoid abscess can be there. Simple mastoid abscess over the mastoid process, zygomatic abscess over the zygomatic process, Cytalis abscess along the posterior belly of digastric muscle, the abscess formation. Bisol's abscess is relatively more common and more commonly asked in the examination. The Bisol's abscess means the abscess mainly is present at the tip of the mastoid. Main burden of infection is at the tip cells of the mastoid cells, and the pus formation is at the tip of the mastoid. And as you already know, the sternocleidomastoid muscle is attached to the tip of mastoid. Insertion of the sternocleidomastoid is at the medial end of the clavicle. Now the abscess which is formed at the tip of the mastoid can travel along the facial sheet of sternocleidomastoid muscle down towards its insertion. So in Bisol's abscess you will see the abscess formation, that is swelling with abscess at the tip of mastoid on one side, and also the abscess formation at the medial end of clavicle. So in this situation, the treatment which we have discussed will also include the incision and drainage of the abscess not only at the tip of mastoid but also at the medial end of the clavicle, so that the abscess formed at both these areas is drained properly and the patient gets cured. Thank you very much.